total of 115 hospitalizations total during the whole course of COVID. Right now, there are 3 individuals in ICU beds with COVID and 2 individuals on ventilators. So we have very, very few people with COVID in the hospital. There has been a small increase. We've had 32 individuals that have been in the hospital for COVID-related disease from June 1st until now. So in the last 36 days. So that's a little bit higher rate than before, but not significant. And, fortunately, the mortalities have really stayed down. So we're doing very well from a hospital standpoint. And I've been also sharing with some that we have a capacity to increase. If we really had to, we can increase our hospital capacity as much as 30% in some places. For instance, Hilo Hospital is capable of, in a crisis, enhancing their capacity by 30%. So we're doing great with that. We have all sorts of alert systems if we ever start getting close, but we're nowhere near close to taxing our healthcare system right now. And we just appropriated $100 million for PPE. So we're doing the right prep. It's, of course, all comes down to how many cases we end up having and how many people get really sick.
Yeah, we're only a few weeks away from the quote unquote opening on August 1st. Are you concerned considering the recent spikes?
Well, all I can say is people are coming already. I mean, we had over 1,000 people come in, I think, today. And so my job is to try to make things as safe as possible. And so that conversation about opening has actually been kind of a misnomer. The state of Hawaii has been open because we're not allowed to legally stop people, but we're using the quarantine. Now we'll add a whole nother layer of protection, which is a test, decreased by about 70% the number of people that would be positive. So I'm optimistic that we can manage things, and someday, no matter what, we will have to. But I'm not eager to have extra risk. But I will say this, I am really, really concerned about our people not being able to afford food, their health insurance, or their rent. I mean, that is going to cause serious crisis and illness. So these are the things we're balancing. So I really think that if we can keep the numbers very low and be smart about it, we'll be okay. Alaska is doing the same thing. And I talked to their director of health this weekend. She told me it's not the travelers. It's people not following the rules at bars. The bars are even trying to set good rules, but people aren't following them. One guy did performances at 17 bars when he was positive and spread the disease all over the place. So it's not going to be a traveler from, New York who went through pre-screen testing, temperature check, thermal scan, major questionnaire on any risks. That's not where our biggest risk is. It's if one of our own people comes back perhaps and doesn't socially distance and goes out a lot. That's more risky. So we have to balance these risks, and we have to make sure that any visitors follow all of our rules. That's first. That's traveling with Aloha.
Yeah, I'm glad you mentioned that, because there is this kind of perception that it's visitors that are bringing it in. So can you clarify, do you think that the trend now is that it's returning kama'aina that are bringing it in?
It always was, actually. Not because people are not good people. It's just because you come back and then you're here for 4 months and you're back in your regular life and you're going to work and you're mingling with people. That's why each of us poses a higher risk than a visitor who comes for just 7 days and keeps themselves more or less. So the risks are not even. Not that we don't want to keep every possible protection in place. We do. But, if I personally go to a bar and don't wear a mask and don't socially distance, and if I have a cough, then it's going to cause risk. It'll spread disease. So I think just if people stick with the basics, get a test before they come here, no matter who it is, us or them as travelers, really wear masks, really socially distance, and don't take extra risks, we're good. Then we're really good. But I have those concerns. The main thing I'm focusing on is making sure the testing plan works for when we need it, whenever that is. And then also making sure our hospitals have plenty of resources in case the numbers go up. But the utilization at the hospitals has not gone up at all that you could discern since the beginning of the pandemic. So we've been good, knock wood.
That's good. This weekend when I was going around, it looked like there was a lot of military related families and parties going on, and I know they have their own rules. Can you kind of shed some light on how we work with them, with the Department of Defense, to ensure that they are doing their part as well?
Yeah, we've asked them to adhere to the high standards that we have, and they've assured us that they do. But there is a separate culture for sure, and those individuals who we have utter respect for because of their service, they're resetting their lives in a faraway place, and a lot of times they're at bases. So I've spoken with the leadership at Tripler and at the highest levels of Indo-PACOM, and they know that the reputation of the military is dependent on the behavior of our soldiers, and so they're very cognizant of it. I think everyone's human, and so it's really hard to go into full lockdown, and it's also hard if you're young. If you're young and feeling a little bit more invulnerable, it's hard to really stick to extremely conservative rules. It's hard, but you need to, because if you don't, you get what happened in Arizona and Texas. Those guys basically took a 3-week off from the pandemic, and look what happened. It just went right up the mountain again.
Yeah, and you bring up a good point, because this is kind of, people have said this to us, why are we reopening, quote unquote, loosening our guidelines with the quarantine when the rest of the country is experiencing a surge?
Yeah, all I can say is there is a very serious discussion about what happens when people lose their health insurance, they lose their business, they lose their capacity to buy food for their children. That's happening to about 1 out of 5 of our residents right now. And the longer it goes on, the deeper the strain on society, on people's mental well-being. I know personally of individuals that have committed suicide because of the stresses. I know personally of the surge in domestic violence and what happens at the hospitals. I was on call this weekend and was observing these things. So it's not, there's no best answer here. The best that I can come up with is you put as much protection in place as possible so that we don't see spread. Do the right things. Don't let super spreaders occur in certain settings like bars if they're not following the bar's own rules. And then prepare, because from a constitutional standpoint, no state is allowed to prevent anyone from coming in. And by the way, small caveat, people aren't listening when we tell them to be in quarantine. They're defying the quarantine, so might as well have them get tested negative at least. And so that's where I fall on this thing. Add extra safety. Don't shy away from hard decisions. And look, we can always pull back if it gets risky, but when we're only at 12% of our ventilators being used, and it's only 2 of the 459 ventilators in our whole state that are connected to this, it'd be hard to argue that we're not ready.
Mm-hmm. And, just to clarify again, so the numbers that we see from Tripler and the military stations, is that separate from our state numbers that we release?
I believe
or
we keep
are
them
they
together.
in it? It's together?
They're integrated. I don't know if they're integrated, every 24 hours or if they give us bunches of data, but the director of health can answer that probably better. We rely on a full partnership with the military, and it is a very different population because it tends to be completely skewed towards people under age 40, as opposed to our state, which is skewed the other direction. But all things being equal, I still know that all the hospitals have the same capacity, that have the same ability to care for people, and that our kupuna have been safe. So the big picture is we're doing very well, but we don't want a lot of, uncertainty. So we're watching very carefully. We're even talking and checking the bookings and what have you, so that we're prepared to make sure they got their test, to make sure that they understand what our rules are, and really realize that there are going to be $5,000 penalties if people try to break the rules.
Mm-hmm. The 19 deaths that we have, do you have like a broad picture of who they are? Are they all elderly? Are they all nursing homes? Can you just kind of remind us about who was really affected?
They're all old people. Nationally, it's been 81% of all fatalities have been over age 65. I'd have to check, but it might be every single one of our individuals that passed away was elderly and tended to be in their 70s or 80s. So there were a couple people, I think, that had been connected to nursing homes or institutional care, but even the outbreak that we had didn't result in a large number of fatalities. Thank goodness. Our hospitals did a great job. So,
and they all had underlying conditions.
Everyone that I'm aware of already had chronic disease and had health concerns. So we're following that model. I don't know of anyone that has been in their 20s or 30s that succumbed to the disease in Hawaii. Nobody. And I definitely don't think any children have. So it's not surprising to me when you have this much capacity and you can give people advanced treatment. We have the capacity to give remdesivir. We have the capacity to give steroids, dexamethasone. We have the capacity to give people the plasma that has antibodies in it. All of those things we have full capacity to do, and we have a ton of intensive care unit beds. So we're in a good spot. But look, I don't like seeing one person die of COVID, right? So call me crazy, but it's good to be best in the country, right? Best with the rates, best rate of lowest mortality, continuously having the highest capacity in the hospital. So that's what we're aiming to keep. And we know that a time will come when people will return from the mainland at some point. So I just want a system that's workable and in place.
I did talk to someone at the Hawaii State Hospital staff there. There was a positive case identified there, and they're really concerned. They're worried because they haven't been tested broadly.
They should be.
What can you say? Yeah, what can you say about that? They're really worried because that's a hospital, and they cater to the prison system, right? It could get into those populations and the homeless populations.
I personally have recommended, and we'll keep recommending, that we give them extra testing capacity. So we can test now up to 5,000 people a day. Today we only did 650 tests this last 24 hours. We should be using those extra tests to protect our doctors and nurses and patients at these facilities. So extra testing is absolutely good. People hate getting the nasopharyngeal test though, but the immediate moment that anyone has a symptom, we test. And then, of course, they're in close contact at the Hawaii State Hospital. It's difficult with people with mental illness, right? Because you can't have a rational discussion a lot of the time. And so it's difficult to get people to socially distance, just like it's difficult to get very, very young people at schools to socially distance. So there are different groups that are higher risk. And that's why in the coming months, we'll be testing more at these places.
So actually at this point, though, that they're not doing broad scale testing over at the state hospital.
I don't know what Run has arranged there, but I do know that if they request it, we'll do it. It has to be done for them. If they have any concerns, I've talked to them on a couple occasions. Right now, they're struggling with potential budget cuts also, and it's a very tough time because we all know that with the extreme budget shortfall that's coming, this speaks to that again. People they want to be totally safe and healthy, but if we're going to have billions of dollars of cuts to services, that would include our hospital services. And then you won't be able to do the testing. You won't be able to provide the extra on-call services and so on at these facilities. So it's all connected. It's one organism. So I'm somewhat, I want to be direct. I'm somewhat resentful when like the mayor comes out and says suddenly maybe pull the plug on a plan. Well, if we're doing what we can and it's meant to be safe, if you pull the rug out, someone is going to hurt themselves or someone else is going to lose their home. Meanwhile, the healthcare system is spent day and night getting ready just in case. So it's time for sober and thoughtful processes and to make it as safe as possible. And that's the message I want to send to people.
Okay, great. Oh, just before I forget, I just had one final question about masks. I know we are really pushing for masks, and a separate story I'm working on is actually how private companies are struggling to enforce it.
Yeah.
Is there, because people just will fight back. I love your mask.
Not me. I'm all in. Look, people have to wear masks. And if you're not wearing a mask and you're close to one of your coworkers, you might not like masks, but you're going to like a ventilator a lot less. I can tell you that. So
We can't do anything to force the private sector, though, to do policies to enforce it, can we, though?
We can. We could do it statutorily. And if it remains a problem, you can bet that will happen.
All right. Well, appreciate your time, Lieutenant Governor. Always good to see you.
Cool. You too. It's cool to see you.
Yeah. Thank you so much.
All right. Bye-bye.